Hello, this segment of the SPIVA Toolkit will focus on key informant interviews. The SPIVA Toolkit was developed by the San Francisco Bay Area Advanced Practice Center. The San Francisco Bay Area Advanced Practice Center is a partnership between the San Francisco Department of Public Health and the Center for Infectious Diseases and Emergency Readiness. Our work is funded by the National Association of County and City Health Officials. The APC is part of the network throughout the United States. The San Francisco Bay Area Advanced Practice Center has an expertise in infectious disease and emergency preparedness. It has developed two toolkits, the Infectious Disease Emergency Response, or IDER Toolkit, and the Seasonal and Pandemic Influenza Vaccination Assessment, or SPIVA Toolkit. You can find more information about these toolkits on the San Francisco Bay Area website at sfbayapc.org. The SPIVA Toolkit highlights community assessment as a tool for emergency preparedness. In using the toolkit, we hope that it helps inform current and future planning, marketing, and risk communication activities. By using the methods proposed in the toolkit, we believe that incremental and continual planning will allow for more efficient preparedness efforts. And overall, that the tools available in the toolkit may be applied to both seasonal and pandemic influenza, as well as other public health campaigns. The presentation objectives are to discuss key informant interviews as a viable data collection method in community assessment, to identify how key informant interviews may be used in planning for seasonal and pandemic influenza campaigns, and to discuss how local health department staff may use key informant interviews for infectious disease emergency preparedness. Our approach to community assessment is an incremental one, using three different community assessment methods: key informant interviews, focus groups, and community surveys, with each method's findings informing the next and further refining and developing the one that follows. What is a key informant interview? It's a semi-structured interview with someone deemed to have expertise that's acquired formally or informally. The interviewee, therefore, is an expert and key in providing information because they are immersed in our community of interest, and their experience informs or enhances what information one may have in one's position at a particular local health department. The input of the key informant, opinions, and recommendations are used to guide the development of additional data collection and assessment procedures, such as focus groups or surveys. Why do we conduct key informant interviews? To gauge the level of familiarity of an issue or topic within a community, to identify who else among a community ought to be included in an assessment, to gain insights culled from others' experiences, and to evaluate products or practices prior to general dissemination. How are key informant interviews conducted? In a variety of ways, included in person, by phone, or a combination of technologies that allow for an interpersonal exchange. They may be structured or semi-structured interviews. Why would one even consider doing a key informant interview? Well, let's consider this situation. Low vaccine uptakes in many communities, hard to reach populations in local health department jurisdictions, ambivalent or hostile attitudes toward vaccination, not enough information about communities. If you believe any of those to be a problem, then key informants may be a solution. How do we find these key informants? Let's consider the following. Who are the newsmakers in your community? What is the name or whose name again and again appears or is heard when your topic of interest comes up in discussion? Or who has an established name recognition and is associated with your topic of interest? Answers to those yield names. Those become part of the roster of your key informant. Let's take an example. Let's say you had to develop a vaccine campaign for seniors, but you were unaware of how best to reach these seniors. At your local health department, you might have developed campaigns in the past, but let's say there's a particular segment of your community who you are not acquainted with. Who might you call to let you know more about this particular segment? Key informants. They might be obtained from local senior centers or any other service centers that specifically provide services to this community. In a second example, let's say we have a segment of the community with particular disabilities. Perhaps a group of people who are challenged in their hearing ability. how one might be able to communicate, or what would be the best means of communicating with this particular community. Not being a member of that community, I might have to resort to key informants who are more immersed in providing services to this particular segment of my community. What about transient communities, or people who may not access our vaccine clinics, such as a homeless population? People or service providers or centers that provide services to this community of homeless persons may be among the key informants whom you invite to participate in an interview. Here are some applied uses related to H1N1. A UCLA study was about finding or using key informants among emergency room personnel in order to determine how to best prepare for influenza triaging in clinical settings. The Seattle-King County Advanced Practice Center has used key informants in their audience testing to determine what messages to include in their informational education campaigns about H1N1. And in North Carolina, there has been use among different groups to understand the nature of communications among specifically African American, Native American, and Hispanic populations. So, key informant interviews are an in-depth conversation with an expert. They provide knowledge, opinions, and advice, and are a simple and direct approach, but they still require planning. Some of the steps for effective key informant interviews include defining your interview goals, identifying who your key informants will be, taking an approach that includes developing a protocol as to how you will invite your key informants, how you will remind them and find a convenient time when they are available. You design this interview protocol to include statements about confidentiality and how the information that will be obtained from your key informants will be used and how it will be disseminated. Pilot testing the interview questions will be helpful. We describe in the toolkit as well how to conduct the interview, and we offer tips, suggestions about doing so. And we also describe about the use of findings and how to communicate them. Overall, in community assessment, the toolkit includes descriptions of key informant interviews, focus groups, and surveys, all mixed methods used in community assessment. The advantages of using key informant interviews are that there are built-in level of accessibility to communities that are provided to the interviewer who may not be of that community. Information stems from credible community sources, and the accumulated information spans the range of perspectives within a particular community group. There are disadvantages to key informant interviews, and among them, it's the selection of who is key. That requires a relationship broker. If you're not acquainted or immersed in the community of interest, you have to rely on someone who is. That may be a private vendor, or that may be someone, a colleague in your health department who is acquainted given the type of work that he or she has done over the years, and the groups with whom that person has built relationships. Another disadvantage is that the interview time competes with key informants' commitments and priorities. So one has to consider how best to make the interview time a convenient time so that the information that is obtained from the interview is not rushed or hurried. The use of information may be restricted due to confidentiality agreements, and therefore any quotes or other particular information may not necessarily be attributed to a single individual. Setting up key informant interviews. We offer some suggestions here. Communicate the interview purpose and the duration of the interview to your interviewee. Confirm an uninterrupted period with that person. Ask if the interview questions would be desired in advance to allow the interviewee to prepare, or research information that would allow him or her to best provide you with responses to your questions. Obtain permission to use quotes, and make certain that you state the level of confidentiality and how the information will be disseminated. Will it be specific to your colleagues? Will it be eventually published and widely disseminated, for example? In conducting key informant interviews, there are a couple of things that we suggest as tips, including open-ended questions. Those are the questions that aren't necessarily just answered to with a yes or no answer. Include specific questions as well that are particular to your concept or construct of interest. Listen. Practice the listening skills. You are learning from the people that you are identified or have identified as key informants. Not so much doing the talking. Include probing questions as needed. Those are the follow-up questions after you've opened up with general open-ended questions. Keep to the scheduled interview. Allow the interview to ask questions of you too. Often the questions are, how will the information be used? Or will my name appear in some report? And then you're allowed an opportunity to follow up or ask for an opportunity to follow up with that person, because often what happens in an interview, if it flows naturally as it ought to, and you use recording equipment, some wording may not be heard, or the response may not be as clear as you would have expected, and you might want the opportunity to follow up with the key informant on a separate occasion. So, some takeaways from this presentation. Key informant interviews are a viable way to assess community familiarity with issues that are pertinent to vaccination. Successful key informant interviews require planning to yield useful data, and key informant input provides an introduction to community input for successful vaccination campaigns. For more information about key informants and to view the entirety of the seasonal and pandemic influenza vaccination assessment toolkit, the SPIVA toolkit, please visit the website of the San Francisco Bay Area Advanced Practice Center at sfbayapc.org.